This part will start with the joint movements. Now, we're able to produce movements because our muscles pull on the bones that they attach to. The fixed attachment, or the beginning part of the muscle, is called the origin. This is the part that doesn't move as much. But then the more movable end, the end part of the muscle, is called an insertion. Movement at a joint occurs when a muscle contracts. When it contracts, muscle gets shorter. And when that happens, its fibers pull the insertion towards the origin. We'll talk more about that. So now here are types of joint movements. Abduction versus adduction. This is when you move your arms or your legs away from the midline. So abduction is moving away, think to abduct, but adduction means to bring them back. As you can see in the picture below, abduction moves away, either your legs or your arms, but adduction move back in. Next, flexion. Flexion means bending. So when you bend your elbow, bend your knee, bend your fingers, that's called flexion. Extension instead means straightening. So when you straighten your elbow, straighten your knee, your fingers. Hyperextension is to go beyond extension. So when you extend back more and more, that's called hyperextension. Lateral flexion, on the other hand, this is bending to the side. Dorsiflexion and plantar flexion, these are for your ankle. Dorsiflexion is when your foot moves up and your toes point up. Plantar flexion is when your toes point down. So plantar flexion is when you're standing on your tippy toes. Circumduction is when you move your arm or your thigh in a circular movement. And so drawing a circular shape is circumduction, as you can see in the picture. Rotation, we do this with our neck, we're just rotating. You don't see this in a picture, but we know what that is. Medial rotation versus lateral rotation. Medial rotation is when you move your arm or your leg more towards the midline, more medially, rotate it. But lateral rotation is when you rotate outward, more laterally. Supination versus pronation. These movements are done when the radius rotates on the inside of the ulna. Supination is when your palm is facing forward or up. Pronation, when your palm faces down or to the back. Inversion and eversion, these are for your ankle. Inversion is when the bottom of your foot faces in. And so when you do this with both ankles, the bottoms of your feet are facing each other. Eversion instead means the bottom of your foot faces out, more laterally. Protraction. Protraction means when you move your jaw to the front or your shoulder to the front. You can also do this with your neck, move your neck to the front. So protraction, move to the front, and retraction, move those parts more towards the back. Next, elevation means to move up your shoulders or your jaw, your mandible, upwards. And depression means to move them down. Next, we'll go through the major ligaments for the shoulder joint. Coracohumeral ligament. And so the name means that this ligament is between the coracoid process and the humerus. Glenohumeral ligament. This goes between the glenoid of your scapula to the humerus. And the transverse humeral ligament is going across in between the scapula and the humerus. Next, the elbow joint. 3 ligaments here. Radial collateral. So this is on the side, more on the radius side. Then the ulnar collateral, again on the side, but more going to the ulnar side. Annular ligament. This one is going around the head of the radius. Hip joint, we have the iliofemoral, goes between the ilium and the femur. Pubofemoral is between the pubis and the femur. And the ischiofemoral is between our ischium and the femur. For the knee joint, patellar ligament. This is attaching to the patella and then going down to the tibial tuberosity. Tibial and the fibular collateral ligaments, these are on the sides of our knee. So tibial or the medial ligament is attaching down to the tibia, and the fibular ligament attaches down to the fibula. Anterior and posterior cruciate ligaments, these are on the inside of the knee joint. Anterior is more on the in the front, posterior is on the back. Then the medial and the lateral menisci, these are the cartilage discs between the femur and the tibia. And next we'll talk about the joint disorders, diseases. Sprain. Sprain means tearing of ligaments in our joints. Bursitis is the inflammation of a bursa. And a tendonitis is the inflammation of the tendon sheath. Next, the different types of arthritis. Rheumatoid arthritis. This is considered to be an autoimmune disorder. So here, the person's own immune system is attacking the joint. Osteoarthritis instead is degenerative. So here it occurs with aging. This is more just wear and tear on our joints. And here the cartilage in both rheumatoid and osteoarthritis, the cartilage is getting worn down. Lyme arthritis, this is caused by the Lyme disease, which is actually a bacteria, and it's passed through the tick bite. So Lyme disease can give us flu-like symptoms, but then the bacteria can go and attack our cartilage in our joints. One more type of arthritis is called the gouty arthritis. This is caused by uric acid crystals that accumulate in joints. So then these crystals can cause the joints to become inflamed and slowly get destroyed. Lastly, what happens to our joints as we get older? Joint stiffness is an early sign of aging. Many develop arthritis as they age. Fibrous joints start to change, but interestingly, they can strengthen over a lifetime. Cartilage stiffens, ligaments lose their elasticity. We see changes in the symphysis joints, in the vertebral column, and so the cartilage here starts to degrade. Synovial joints lose their function. Disuse of the joints leads to lower nutrient supply. So it is actually very important to keep exercising, to keep our joints limber. Then activity and exercise, as I said, can keep the joints functional longer.